Good morning. This is a report on Melody. Melody Dixon is a 71-year-old female, patient of Norma Halib. She is here to rule out myocardial infarction. She has a history of diabetes and GERD and presented to the emergency department with complaints of indigestion and mid-back pain for the past 13 hours. She's married. She has one adult child that lives nearby, active and caring for her grandchildren, and she's a retired teacher. She has no known allergies and has a full code status. Last vital signs were a temp of 98.9, blood pressure 150/90, heart rate 94, respirations 18, and SATs are 96% on 2 liters nasal cannula. Last pain rating was a 1 out of 10. In the ER, she received aspirin 325 milligrams, 1 nitroglycerin sublingual tablet, and 2 milligrams of IV morphine. This was about 2 hours ago. She has an 18-gauge right AC IV running D5 half normal saline at 50 milliliters per hour. She is NPO and on bed rest. She's in standard isolation precautions and a moderate fall risk. She's alert and oriented. Heart rate has been normal sinus on the monitor. An ECG in the ER showed a 0.5 millimeter ST segment elevation, not high enough to be conclusive for heart damage. The chest x-ray showed no significant findings. Respirations are normal and her lungs are clear bilaterally. She's using the bedpan, has positive bowel sounds in all quadrants, and the last bowel movement was yesterday. Her skin is intact, mucous membranes are moist. She has been slightly weak when transferred, but transfers independently. She has been pleasant, but slightly anxious. Her family member is at the bedside. Her creatinine kinase NB, and troponin were all slightly elevated, but not conclusive for infarct. Urinalysis was negative. The patient is stable, but should be observed closely for cardiac changes. We're going to monitor closely, promote comfort and rest to reduce the oxygen demand. Mrs. Dixon is scheduled for a stress test this afternoon. They will call when they're ready for her. Her vital signs are due again now.